Hi my dear doctors, we are discussing about the anatomy of upper limb. We finished the scapula, we discussed about the humerus in our previous lectures, we discussed about the radius. Now we will discuss about the ulna bone. So the ulna is one of the bone which help in the formation of the elbow joint and which help in the flexion and extension of our uh, elbow joint. So this is the ulna bone. So before going through the ulna bone, I want to demonstrate some point here that there is a structure at the end of the humerus. That is the trochlea, the coracoid process, and on the back side of the humerus, okay, present here, okay, that is the fossa, that is the Olecranon Fossa. Okay, we have to remember this. Now we will go through the ulna. So this is the ulna. So again the same. Again we have the anterior, the posterior, backside, the lateral, the medial, the superior, and the inferior view of the ulna. So we'll discuss about first the anterior view. So as I show you that there is the trochlea and the coracoid fossa and olecranon fossa present in the humerus joint, okay, at the lower portion. So that or the fossa or the point where the attachment of these areas of the ulna. So the whitish area we can see here the trochlea notch forming the joint with the trochlea at the back side of the trochlea, okay, and this is the area which fit lower area of the trochlea, that is the coracoid process which fit into the coracoid fossa. So here we can see like this, okay, this is the coracoid process here. This is the coracoid process which fit into the coracoid fossa, and here the trochlear notch. So on the back side, if we rotate like this, we can easily see like, okay, like this, the joint is formed like this. So on the back side, as I said that in the humerus there is a present the Olecranon fossa. So in the Olecranon fossa, this bone, the head of this part is fit, that is the Olecranon process or the Olecranon of ulna. So this is the Olecranon, then the trochlear notch, then the coracoid process. So here we can see on the lateral side again the joint, formation of the joint or the articulating surface here. So this articulating surface help in the formation of a radioulnar joint, which help in the rotation of the forearm, okay. So this is what the radial notch of ulna. The radial notch of ulna present near to the elbow joint, while the ulnar notch of the radius that is present on the radius joint, that is present toward the carpal joint, okay, toward the lower portion of the radius. So this is studied. So a little bit down, if you come down, then there is a tuberosity. So this tuberosity is called as the ulnar tuberosity. So here we have the ulnar tuberosity. You can see this is the ulnar tuberosity, okay, and below the radioulnar joint or the ulnar notch or the radial notch of ulna, there is the structure, okay, that is called as the supinator crust. So we can see here the crust, okay, like this. So this is what the supinator crust. Now come down the anterior surface, the anterior border, come down here the head of ulna. This is what the articulating surface which form articulation to the carpal bone, the articulating, yeah, or the articular circumferences, okay, and just above that we have the head, okay. So we can say this is the head of ulna. So on this side, on the back side of the head, there is the elongated part, and this part is called as the styloid process of ulna. The styloid process is same as that of the radial styloid process. So ulna also have a stellate process at the toward the head. Okay, this one. So now the posterior view. Okay, this is the posterior view. So posterior view, there is the one important structure or a ridge-like structure that is help in holding the interosseous membrane, that is the interosseous border. Okay, this is what the interosseous, sorry, the posterior border and the interosseous border. So this is the interosseous border. So interosseous border is present between which hold the interosseous membrane between the ulna and radius, like this. Okay, so here in case of radius, the interosseous border is here, and on the posterior side this is the ulna. So this is the interosseous border of ulna. So this is some above the ulnar bone. Thank you.